Hello, I am representing against Indian Society of Sex Medicine and giving the complete knowledge about anatomy and physiology of female sexual mechanism particularly and development. At birth, 2 millions of ovaries At birth, 2 millions of ovarian follicles are present in the two ovaries and only 3 lakhs at the puberty. Only about 450 follicles develop enough to expel their ova. The remainder degenerates. A single ovum is expelled from ovarian follicle into the abdominal cavity in the middle of menstrual cycle. This ovum passes through the fallopian tube into the uterus. If the ovum gets fertilized by sperm, it implant in the uterus where it develops into fetus, a placenta and fetal membranes. Anterior pituitary secretes follicle stimulating hormone called FSH and luteinizing hormone called as LH hormones, which act on the ovaries. As a result, estrogen and progesterone hormones are secreted by the ovaries. The ovarian hormones are secreted at drastically different rates during the different parts of the menstrual cycle. The duration of menstrual cycle is of 28 days. Though a cycle of 20 days to 36 days is considered as a normal. Means if your cycle is after 20 days, don't consider is early, or if it is a 36 days, don't consider as a late. After that, you may consider as late in cases of PCOD and other problems. At the age of about 8 years, pituitary secretes progressively more of gonadotropic hormones, which culminate in the initiation of the menstrual cycle between the age of 11 and 15 years. This culmination is called puberty. At the beginning of menstruation, the concentration of FSH and LH increase. The increase in FSH preceding that of LH by a few days. One of the ovarian follicles become highly developed and secrete estrogen. This developed follicle reaches the size of 1 to 1.5 centimeter at the time of ovulation. Generally, ovulation occurs 14 days after the onset of menstruation. The rate of secretion of LH hormones by the anterior pituitary increase. Follicle stimulating hormone level also increase. These two hormones act on the follicles and cause rapid swelling of the follicle. LH has specific effect on follicle. Estrogen level falls, but progressively there is increase in progesterone level. As a result, ovulation occurs after expulsion of ovum from the follicle. The remaining mass of cells is called corpus luteum. The corpus luteum secretes large amount of progesterone. Now remember here, if you want to the baby, if you are planning for the baby, It is a better chance you get after 14 days of your MC, including MC cycle. That time ova is secreted, and that is the chance of sperm to fertilize it. After a week or so, the corpus luteum involves and loses its secretory function. Corpus luteum degenerates after about 12 days. After that, corpus luteum degenerates into 12 days from ovulation. Means 26 days of menstrual cycle. The paucity of secretion of estrogen and progesterone lead to menstruation by the uterus, follicle stimulating hormone and luteinizing hormone initiate the growth of the new follicle. During the first few cycles after puberty and for several years prior to menopause, ovulatory cycles are usual because LH surges is not potent enough at these times to cause ovulation. Menopause is approximately at the age of 40 to 50 years. At that time, ovulation stops. No secretion of ova. During the childhood, estrogen hormone secreted and small in quantity. Following puberty, the quantity of estrogen secreted under the influence of gonadotropin hormone increases. The lead to the appearance of secondary sex character. The fallopian tubes, the uterus, and the vagina increase in size. The external genitalia increase in size. There is a deposition of fat in mons pubis. Progesterone hormone promotes secretory changes in the endometrium. It also promotes development of lobules and alveoli of the breast. That's why the breast enlarges in puberty. In short, we tried to explain you how the function of menstrual cycle, how you can reach to the ovulation, which time is better for intercourse, for the baby purpose. Thank you very much. Subscribe our scientific explanation and our channel.